What you, sir?
Yeah. So I and how that sort of trickles down to the end user. I think initially also it was mentioned that budget is a nice statement of intent, nice intention, well made out. Uh, it's not much of use at all. Good intentions are nice to hear, but they don't create impacts unless they are utilized. So I'll take a more broader development perspective, going beyond just issues around what was presented yesterday. So looking at the budget and the plan itself, I see there are two components to it. One is the that has to be appropriate allocation. To make that happen, there has to be a budgetary allocation as well. So there are two components, and there has to be sanctity to both the allocation and to the intention. Now, only when these two are respected, we will see the good end result. Generally, as we see as development workers, what we see across the board in different departments, different development processes, is that there is a tendency to focus more on the allocation itself, because that is more seen, more visible. Let's say there is a allocation for capital investment of X crores. The king of X crores, whether spent or not, becomes very easy. Whereas the intention behind that health of the general community is generally tracked and reported and seen as utilized is just this money part of it, the allocation part of it, and we don't look at the intention, whether that has been actually fulfilled at all. So I think when we talk of actual utilization, we have to look at the allocation part, whether whatever it is for the said intention, and the fulfillment of the intention itself. So from this point of view, for enhancing the utilization, I think there are certain key steps that we need to strengthen. What we see generally is that there are general, well-known hurdles and roadblocks, if you may. One such thing is to keep quiet till the end of the year or end of the reporting period. And just as we reach January, February, or March, go into a hyper spending mode and say that, okay, by end of March, we have utilized the whole thing. But that doesn't serve the purpose. It doesn't really translate the intention for which that money was actually allocated into actual impact. So we need to have a mechanism which would better ensure a spread of this sort of spending over the entire 12-month period. Make sure that regional contexts and expected seasonalities are taken into account when we plan it. So converting this budget, which mainly talks about money, into actionable plans at the grassroots is very important. Now, the union budget has come up with a very gets utilized, it has to trickle down to the next and the next level. So this has to be released to the states, and then the states have to then make sure that their contribution is, and then it has to trickle down to the district level where it's actually utilized. So there are these steps, there are these bottlenecks, if you may, which need to be eased out. Right now, yeah, we do have a very good mechanism which is being put in place for periodic reviews, midterm reviews, monitoring and evaluations, but that needs to be streamlined and strengthened so that, there is a mechanism to red flag the non-starters, slow runners, so that there can be appropriate pushes there can't be appropriate mechanisms to overcome and help out the budget utilization part, and make sure that the intention for which it was actually meant is actually realized at the end of the year. So this calls for good governance across the board, transparency, disclosures, etc., and decentralization. That sort of brings me to the point that I feel is very important. Health, as we all know, is a multifactorial, multidimensional state, not just one absence of a disease, as we often call it. So for the health of health, we also need this sort of collaboration. We have to make it channel. Now, that calls for intersectorality, interministerial collaboration, and that is something that I feel, again, as a beyond of health and health department and health ministry, and in some way linking up to your next question of youth and adolescents, there is a lot intersectoral approaches can give a much bigger bang for the buck. The health is actually determined by the health determinants, not environment, nutrition. These dimensions that are not directly under the Ministry of Health need to be harnessed, need to be galvanized to make sure that health is achieved. And there are a lot of room for that sort of collaboration. Swachh Bharat Mission, for instance, has on paper a good opportunity for convergence there. But I, being a very active WASH warrior at the convergence. Similarly, Jal Jeevan Mission, there have been excellent allocations and excellent intentions of both these great missions. But if these two can actually make things happen, make sanitation a reality, and if water, potable drinking water, really flows through the pipes that have been laid under Jal Jeevan Mission, then achieving health for all will become far easier. And by there's a care to tertiary care in this budget. Yes, I agree. But if parallelly we can work in tandem with allocations that already exist elsewhere, I think there can be a much bigger bang for buck. And we need to explore on that sort of collaborative approaches to make sure that both the health intentions are met and the department's intentions are also met under Jal Jeevan Mission and Swachh Bharat Mission. I feel the youth that you mentioned, the group that I also closely work with, can be a great game changer. They can make or mar any nation, any society for that matter, and they can also be, they are highly vulnerable. Adolescents and young adults, youth, they face a lot of vulnerabilities, especially in today's. They're already at risk, and unless their power, their energies are channelized into positive nation building activities, we will definitely have a much greater problem on hand. Now, let's take the issue of addictions, which again, struggling addictions. The first use always occurs at adolescents or as young adults. And if the health department can actually work in strong collaboration with the Ministry of Youth Services and the departments of and the we can collaborate and converge efforts. They would have some budgets as well, and the health department would have its budget. So if these two budgets can be actually converged, there can be definitely far greater impact. And youth can actually be harnessed. I have worked with the NSS, the NCC, and in terms of behavioral change communication. They can themselves keep a strong develop a strong momentum to positive health from a more dependent on alcohol. But there are new demons emerging, the device addictions, the social media, which are creating havoc in multiple ways, adding on to the unseen burden of emotional health, mental health challenges, and leading on to a lot of unrest in the society in general. So I feel that for a win-win, we need to look at a strong convergent approaches across ministries and across departments, and see if we can have a proactive mechanism to nurture and develop these partnerships down the line. If it can start from the center down to the state, well worded in our policies, we see that at the level of action, there is not enough focus, not enough force that is transmitted to actual action. So I feel that to ensure proper budget utilization, this sort of transparent approaches, a good action plan to make sure that the intention as well as allocation both are sanctified by proper leverage funds from associated and related ministries for a set purpose will go a long way in enhancing our intended impact.